Meanwhile, some people who were infected with COVID-19 are still reeling from its effects long after they recover from the virus. It's called long COVID, and some of the symptoms include shortness of breath, brain fog, and chronic fatigue, just to name a few.
Yeah, long COVID is a recognized national crisis, and now State Assembly member Bill Quirk has made a budget request that the state of California allocate $120 million toward the establishment of a long COVID Centers of Excellence program to be managed by the University of California in order to help an estimated 2.7 million Californians with long COVID.
That is a lot. Joining us now is Art Miron, PhD. He's a principal author of the proposal. First of all, welcome, Dr. Miron.
Thank you very much. I'm happy to be here.
So how would these centers work, and how much of a benefit do you see them providing for people with long COVID?
Okay, so Centers of Excellence will perform clinical care, carry out research, and engage in education, training, and outreach. Currently, we have a clinical care crisis in long COVID with perhaps 24 locations in California where people can get adequately treated. So we're talking about up to 2.7 million people, which is roughly 7% of the California population. So these are really big numbers. So Centers of Excellence will be able to reach the California population by housing satellite clinics throughout the state and engaging in telemedicine. This will facilitate treating underserved populations and people in rural and outlying areas. For example, if a group of physicians in Escondido or El Cajon wish to treat long COVID, they could obtain certification from a Center of Excellence and affiliate as a satellite clinic and receive funds under the program. Centers will also be responsible for statewide education of physicians and other healthcare providers. They will not only provide videos and written material, but will serve the community through real-time telementoring. With long COVID being an emerging field, a close coupling between clinical care and research is essential. State funding for research will enable California core competencies, such as stem cell research, and will also facilitate the attraction of federal funds. So having a coordinated statewide approach is critical to the success of this effort. UC, with its experience at managing grand-scale projects and housing centers of excellence, is very well suited to play this leadership role in developing the needed statewide infrastructure. And if I haven't, I should make it clear, by the way, that the intent here is for the university to manage the program, but the monies would go both to the university and to private entities throughout California in order to bring together the most highly qualified entities and facilities to address this problem. So we're looking at an unprecedented situation in healthcare right now when we're talking about a couple of million Californians. This is a grand challenge that needs to be met by a grand effort, and we need to act now.
Dr. Miron, as you said, you come at this from a background of mathematics, your doctorate in mathematics, but you've also done work on chronic fatigue syndrome, and you say this is closely related. How so, and what are the impacts that you're seeing?
It is very much related. In fact, a majority of those patients with long COVID have symptoms that are typical of chronic fatigue syndrome, which, by the way, has the name ME/CFS now. We're talking about brain fog, fatigue, entering into what are called crashes, where if you exercise too much, you can be out of commission for days or weeks or months. And Dr. Fauci has on several occasions pointed out the similarities of symptoms between ME/CFS or chronic fatigue syndrome and long COVID. And furthermore, experts predict that roughly 10% of COVID patients will develop ME/CFS. And I can assure you that we're talking about a very highly debilitating disease. So an important point I'd like to make is, you hear this talk about how we're over the hump and people don't have to worry as much. We can think of COVID as the flu. And that may be true for a lot of people, but what is different between COVID and the flu is that there is no long flu, but there is long COVID.
Very
and
good
even if you
points.
don't die,
Yeah.
you can be impaired for your life.
And there are a lot of people who are suffering, as you pointed out. Art Mirren, leader of the state chapter of the advocacy organization Me Action, thank you so much. We really appreciate your time.
Thank you very much.